I'm June Gruber, an associate professor of psychology at the University of Colorado Boulder and director of this mental health expert series. I'm delighted to be here today with Dr. Linda Craighead, a professor of psychology at Emory University and director of the clinical psychology training program, to speak with her about her pioneering work on eating disorders and weight concerns. So thanks for being here today, Linda.
It's a pleasure, and I'm glad to at least have some little connection left there with Colorado.
Yes. Um, I was wondering if I could start by asking you to say just a little bit about the kind of mental health work and research you do.
Well, I have worked really in that kind of broad intersection of eating disorders and obesity by particularly focusing primarily on sort of binge eating and overeating, which can kind of cross over between the two areas. And that's been kind of an interesting bridge, since often the people in these two areas don't talk to each other and have some very different philosophical views about how you approach eating behavior.
How
But
did
in particular, recently, I've mostly worked on the development of some mobile applications to work with interventions. And also I've kind of expanded from my adult focus. We'll talk about that. I sort of stretched myself and wrote this children's book, which has really been my, when we talk about successes, I feel like that's been something I did that I want to encourage other people to do, is to really take a little risk and do something a little outside your comfort zone, because I think that's been really helpful.
That's amazing. And I love that you're showing the book. I'll make sure to put a reference to it at the end of our interview as well for people who want to check it out. I was wondering, how did you first go about getting started in this work?
Well, it goes way back when I was an honor student at Vanderbilt. I just happened to luck into working with Dr. Katan at the time, who was an obesity weight loss pioneer. Kind of dates me, but that's okay. And so I did my honors work on a weight control program for college women. And I'd always been interested in sort of really more health issues, kind of grew up in a very health oriented family. So I really enjoyed that, but I didn't really know that that's what I wanted to do, for my primary career. And that kind of got me through grad school. And then at the end of grad school, I just got this unique opportunity to work with Dr. Stunkard, who is a very illustrious pioneer in the field of obesity. So I worked on a research project of his, and that's what really got me interested in the research side of obesity, and kind of went off from there.
So, thinking about your career trajectory when things started, and as you said, kind of went off from there, what were some notable challenges and frustrations, as well as successes that you've savored along the way?
Well, I think the sort of notable thing about weight control, both its challenge and its failure, has been that weight is really not a behavior, and we're behaviorists, we're psychologists. Weight is really an outcome. And initially I thought, well, that would be a great thing because it gives you a very objective outcome measure for changing your behavior. But it turns out that eating behavior and weight don't correlate all that well. So the field has this really big challenge of balancing what everyone wants, which is the weight loss outcome, and how to achieve that, which is through behavioral means, which is what we specialize in, and also what has turned out to be by far the best way to deal with weight, and the most, in the long run, healthy and safe way compared to pharmacological interventions and surgical interventions and all kinds of other things that would be more drastic, but quicker. And unfortunately, they come with side effects, other negative consequences. So we're kind of right back to just working on changing eating behavior. And that's kind of where we started, but it's a very slow, laborious process. And it's hard working with clients because they just want weight loss. They really wouldn't care about their eating behavior if it didn't result in weight loss. So that's a kind of ambivalence that we deal with in the weight loss side of this research. just like the people dealing with anorexia deal with the ambivalence about weight gain. And as far as really successes, I guess I feel like the two things I feel most contributed were when I sort of went outside my comfort zone of as a researcher and kind of applied something more for the lay public. And so I first wrote a book really for adult self-help, and then this one for children. And I feel like I wasn't trained to do that sort of public side of it, and that was very challenging. But I think in the long run, that actually influenced a whole lot more people than most of my other research. So I'm really glad that I kind of took that challenge, and I encourage young investigators to really think about dissemination and applying what we know, because that end of the spectrum is often not emphasized in the scientific world, but it's really important. Otherwise, we're really not going to have the impact on global mental health that we'd like to have.
So then along those lines, thinking about dissemination in the general public, um, what advice would you have to people watching this interview today, whether it's the public or students interested in getting engaged with the field?
Well, I think for students interested in getting into this field, it's really important to have to recognize that it really goes into the bailiwick of health psychology as a subfield. It doesn't even work as well for people in more traditional, clinical interests, because it does require that you know more than I ever knew about the biological side of weight loss. And given the sophistication of current efforts about biology and how that's going to affect weight, I really encourage people to get a strong background in the biological aspects, and to work interdisciplinary, with the health side, because that's, I think, where the future is. And in fact, particularly if people haven't read already about it, this issue of the microbiome, which I certainly don't pretend to be any expert in, but I think that that is going to provide some really interesting, both theoretical and practical applications. It's just going to take a long time because it is so in its infancy, but I think that's a real promising area, much more promising than the idea of more drugs or more surgery. That I think if we can alter our diet to affect our microbiome or find other ways to affect it, that's going to be where the field will actually be able to make, more strides. And I guess the only other thing I would say is I really encourage students to think about early intervention and prevention. I didn't think about that when I first went into clinical. I wanted to see clients and one-on-one and help individuals. And I still actually find that the most personally rewarding. But I think in terms of global impact, if we don't, in all fields, but certainly in obesity, if we don't think about early intervention and prevention, we're going to miss the boat, because there are such biological sequelae to having gained overweight, that may even be not so reversible, that if we don't start with the children and early weight gain, then we really won't make strides in the field. So I encourage people to think about that, even though it's really frustrating to do research on prevention because you have to wait so long to see if it's doing any good. It takes many years to follow up people and see if you actually did prevent anything. So it can be really a challenge for researchers.
Thank you so much, Linda. These are really helpful and also really inspiring answers. And I'm just grateful for you taking the time today.
Great. Well, thanks so much. And I really think this series is a good idea. And I hope it encourages a lot of young researchers, because we really need you. We need to keep this field very scientific and evidence-based. And that's what you're promoting. So thank you.